So we're up to part 4 in this very controversial subject. Is it safe to take supplementation during cancer therapy? All oncologists, and I gotta mean 99.9% would tell you no, don't take anything. So we've been listing, again, this is part 4 in this series, of supportive evidence. So today I'm going to go to some information written by Sharon Palmer, quoting from a Dr. Keith Block, medical director of the Block Center for Integrative Cancer Treatment in Evanston, Illinois. So we'll give him full credit for his writings. We'll get involved in that. Supportive evidence for the use of supplements. Hang on. The information you hear on Health Talk with Dr. Len is intended to be strictly educational and is not intended to diagnose or treat any disease. Any medical decision should be made between you and your healthcare professional. And now, here is Dr. Len. Again, supportive evidence. And again, I'm going to say this, word of caution, do not take just my words and start doing something that would be contrary to what your doctor says. Spend the time, talk to him, give him the supportive evidence, and then see if you can get to some median. If you want help, I'll be glad to help you. 888-231-5325. We'll get started here in a minute. Once again, our prayers go out to all those in the Ukraine that are suffering from the nonsense that's going on over there with Russia. In some circles, there's mounting support for the use of antioxidants during cancer therapy. Dr. Block, who spoke at the 6th Annual Nutrition and Health Conference in Chicago, concedes that there is controversy about whether antioxidants protect normal cells or cancer cells. To provide evidence-based science on the issue, Block conducted 2 systematic reviews. As discussed in the issue of a journal called Cancer Treatment Reviews, his research team conducted a systematic review of published studies examining the effects of antioxidant supplements in chemotherapy, with 19 of the 845 meeting the evaluation. We talked about that yesterday. Today I'm going to talk about the second systematic review examining the impact of antioxidant supplementation on chemotherapeutic toxicity. 39 of the 965 studies met the inclusion criteria. This was published in the International Journal of Cancer in 2008. According to Block, these reviews largely support the notion that antioxidants enhance treatment outcomes, increase survival time, and increase tumor responses. Can I say that again? Antioxidants enhance treatment outcomes, increase survival times, and increase tumor responses. The majority of the studies show that the antioxidant group had decreased toxicities. Antioxidant chemotherapy are safely recommended for metastatic or palliative care patients, and there was no significant decrease in treatment efficacy. There was no significant decrease in treatment efficacy. Dr. Kedar Parisat, PhD, founder and chief scientific officer for the Premier Micronutrient Corp., another leader in the realm of antioxidant therapy during cancer treatment. In 1979, he was the first to show that vitamin C can enhance the effects of radiation and chemotherapeutic agents on tumor cells. In 1982, he discovered that a vitamin E succinate was the most effective form of vitamin E for helping with cancer cells. Many cancer experts believe the science doesn't yet fully support antioxidant use during cancer treatments. According to the American Institute for Cancer Research, the AICR, the current evidence supports both views on antioxidants, that they could interfere with treatment, and they could also protect healthy cells and reduce side effects. A commentary on antioxidant use in cancer therapy was published in the Journal of the National Cancer Institute in 2008 by lead author Brian Lawenda, MD, Clinical Director of Radiation Oncology at the Naval Medical Center in San Diego. The article reports that despite nearly 2 decades of research investigating the use of dietary antioxidant supplementation during conventional chemotherapy and radiation, controversy remains. Lawenda notes that several randomized clinical trials found that the concurrent administration of antioxidants with chemotherapy or radiation therapy reduced treatment-related side effects. Some data indicated antioxidants may protect healthy cells from oxidative damage generated by cancer therapy. Other data suggest that antioxidants can protect normal tissues from chemotherapy or radiation-induced damage without decreasing tumor control. But on the basis of reviewing published randomized clinical trials, Lawenda's team concluded that the use of supplemental antioxidants during chemotherapy and radiation should be discouraged. Even after saying all that, because of the possibility of tumor protection and reduced survival. While the debate over this issue continues, the bottom line is that scientific evidence is not for or against antioxidants in cancer treatment. This is an area of controversy. As a conventional oncologist, Dr. Block said it's more of an issue of potentially interfering with conventional therapy and making it more toxic or less effective. But we don't have a lot of evidence to support it one way or another. Adding to the confusion, some isolated antioxidant compounds have been shown to have protected pro-oxidative effects depending on the dose and route of administration. Due to the complexity of all the variables involved in studying the question and how they impact a specific individual at a specific time, we are limited by what we can say regarding the effects of increasing or decreasing the amount of a specific antioxidant, explained Dr. Lawenda. In radiation therapy, there is at least one well-conducted phase 3 trial that suggested that a specific high-dose antioxidant supplement potentially interfered with treatment. But with chemotherapy, it's much less clear. Radiation therapy and many chemotherapeutic agents cause oxidative damage in tumors during therapy, and if you give antioxidants, it theoretically could inhibit the therapy. Dr. Lawenda stresses that large-scale phase 3 trials are needed. Prasad believes antioxidants are controversial in cancer therapy because of 2 very important distinctions in antioxidant research. First, there are 2 different kinds of doses of antioxidants used. You can divide the data on the role of antioxidants in cancer therapy in 2 categories: a preventative dose, which is a low dose, or a therapeutic dose, which is a high dose. For the preventative dose, the data has shown protection of normal cells and tumor cells, which is what I've been saying all along. You don't want to go to extravagantly high doses of anything. For the therapeutic dose, the data shows that it inhibits the growth of cancer cells, but not the normal cells. People are looking for data for preventative doses, which is confusing. Another important thing that has caused controversy is that people are looking at data for cancer prevention, such as a beta-carotene trial that showed the link between lung cancer recurrence. This doesn't make sense. The data is not the same for prevention of cancer and for people with cancer undergoing therapy. Put aside the antioxidant cancer treatment debate for 1 minute to consider this. Dietary supplement use is common among the 10 million adults in the United States that have been diagnosed with cancer. According to a study conducted by the Fred Hutchinson Cancer Research Center and published in the Journal of Clinical Oncology, 64 to 81% of cancer survivors reported the use of a vitamin or a mineral supplement. In comparison, about 50% of U.S. adults reported using dietary supplements. There was about 25 to 30% more supplement use once you're diagnosed with cancer. Between 14 and 32% of survivors initiated supplement use after their diagnosis. The most surprising finding of the study? Up to 68% of the physicians might be unaware that their cancer patients are using supplements. Now, we'll get involved in more detail on this study. It's big. And we're going to put together this information. As I said, I was going to try to keep all these little tidbits to 10 minutes or less. And that's where we are. If you want help with something like this, 888-231-5325 to track us down. Set up your own consult time. Look at specific product use. Whatever your needs are. Again, God bless you folks, and I'll see you back here for part 5 tomorrow. Take care.